Hi everyone, this is Dr. Sushma Sarilla, consulting homeopath at Fidicus Homeopathy. Next, coming to the body changes or the pathological changes, let's view it in a deeper manner. As you can see, we have a hair shaft or a hair follicle, and surrounding it we have keratinocytes, and then we have sebum here, sebaceous gland here. So what happens on an everyday basis is that the sebaceous gland secretes sebum. This sebum along with the dead keratinocytes is moved upwards to the epidermis. What this sebum does is it builds the acid mantle which helps in protecting our skin from the direct sun rays. Okay, what happens if there are any causes or the risk factors as we have discussed before? What happens is that the sebum production is increased. As you can see, the sebum production is increased and the keratinocytes are clogged inside, leading to a clogged pore. If this happens on a regular basis, or if you're using something which is comedogenic, or if you're using something which is trapping all of these, or if you're having hormonal issues, if you can see, the sebum production is increased and the dead keratinocytes are clogged up here. So what happens next? What happens is that the bacteria which are usually present on the surface of the skin will get into the hair follicle and they will start proliferating or increasing. These bacteria will start increasing and then they will release something called as inflammatory mediators. This inflammatory mediators will call help for our white blood cells. When the white blood cells come in, a lot of pus is seen. So in this stage, you can see a whitehead or a blackhead, and if it furthermore increases, then you can see a pustule or a papule. And then if it breaks out, this sebum or the exudate from the white blood cells is taken out in the form of pus, that is called as a pustule. And even if that is continuing on a longer run, we can see the appearance of nodules which are much more painful, and even we can see the appearance of cysts which are also painful. I hope you have understood the bodily changes that are happening in the acne. Then coming to the types of acne. See, while you're viewing this video, if you're suffering from acne and you don't know what type of acne you're suffering from, when you're viewing this, you can understand what type of acne and what type of treatment you need to take. So let's dive into the types of acne. First one is called as hormonal acne. How do you see if it is a hormonal acne, or how do you identify if it is a hormonal acne? First thing, if it is a female, you will be having very irregular period or periods every 15 to 20 days. You will be having some sort of disruption in your menstrual cycle. As I've previously told you, hormonal acne is nothing but which is caused by disruption of your hormones, that is increase and decrease in your hormones. So how do you identify them? You will have nodular or cystic acne, that is painful acne, red bumpy skin, especially near the jawline, the chin area and the neck area. And you will also see extra growth of hair which is called as hirsutism if you have hormonal issues. This is nothing but hormonal acne. The second type of acne is fungal acne, which is a little rare. You will see fungal acne when you don't wash your face regularly, or if you're exercising, you sweat a lot and you don't wash your face after exercise, you stay with that sweat on your face, it can lead to fungal acne. So fungal acne is usually caused by yeast, and then proliferation of that yeast will cause fungal acne. How do you identify this fungal acne? You will have small bumps along this forehead area. This forehead area along with the upper zygomatic area or your upper chin area, you will be having fungal acne. They are not nodular or cystic, they are small tiny bumps, but the characteristic feature of this fungal acne is that they are very itchy. Then is acne mechanica. This is the second part of your exercise acne, wherein you sweat a lot. Like for example, you're wearing your bike helmet for a longer period of time. You're wearing your baseball cap or a baseball hat for a longer period of time. You're wearing straps for a longer period of time, or compressions, something with your t-shirt. You're wearing it for a longer period of time. You're sweating a lot, but you're not changing the clothes frequently, you're not changing your hat frequently, or you're not cleaning them properly, then you develop something called as acne mechanica. It's because you have a lot of sweat and irritation that happens near this area or the area which is having compressions, that area will start reacting and getting irritated, which leads into tiny small papules. So red color bumpy papules or bumpy skin can be seen near especially the forehead area, and also if you wear compressions for a longer period of time, you can see it even here also near the forearm. And then acne cosmetica. This is more frequent and much regular in our clinic these days because people are using a lot of cosmetics. And if you have an irritation after applying a foundation or after applying some cosmetic product on your skin, if it is aggravated or caused, like for example, you're applying something and on the second day you start feeling bumpier, your skin feels not normal, then that is because of something called as acne cosmetica. These are small bumpy red color papules which appear on the skin wherever you have put the cosmetic product. It is not particular to a certain region on the face. Usual presentation would be on the cheeks area because you put a lot of blush, you put a lot of foundation and concealer on this area. This area will get irritated and then you will develop something called as acne cosmetica, which usually subsides after decrease in use of your cosmetics, or if it is proliferating into nodular, you will need treatment for it. Then this is called acne conglobata, which is the severe form of acne. In whom do you see this? You see this in people who are trying to build a lot of muscle and take steroids. They take testosterone and then this develops. This is nothing but acne conglobata, where you have severe cysts, as you can see, and nodular growth as well, and the cysts and nodules are connected internally, leading to a pus filled under dermis, or you can see that if you palpate it or if you touch it, you can feel that the pus is moving and it is internally connected with each and every cyst on your face. It is severe form and it needs complete treatment to be cured, and also you have to stop your steroids or testosterone if you're taking it. Then the industrial acne, it is very rare kind of acne. If you're dealing with something which has hydrocarbons in it or coal tar in it, and then you start developing something like this on your forearm, then this is called industrial acne. As soon as you regress it from it or as soon as you stop your exposure, this usually will subside. They are just a little itchy, not as itchy as fungal acne, little itchy, but you can see that there are small papules here and there. Usually it is not infectious. As soon as you stop your exposure, it will usually subside. Then acne rosacea. I think you all remember heroine Sai Pallavi. She suffers from acne rosacea. This is malar flush around your cheek area, usually genetic in nature, or if you're using a lot of cosmetics, or if you're having a lot of sun exposure, you will have this malar kind of rash. Along with rash, you will have a small bumps. You can see that it is red in color and it will have a lot of small bumpy papules on your skin, especially in this area. This is called as acne rosacea and it needs treatment. Coming to our consultation options, we have offline and online consultation. Through online, if you're someone who is watching this video and would like to get in touch with us, you can contact us through the above given number, either through WhatsApp or through call. If you're someone who is living nearby, you can come and contact us in person in Manikonda branch or the nearest branch near you. And the online consultation, we do audio as well as video depending on the availability and the time slot. After you had a chat with us and you're okay with the medication after the investigations and all of that stuff, if you want medications, we will send it to you. If it is in India, all over India, the shipping will take 3 days. If it is in US, it will take 4 days. If it is in any country other than US, it might take 5 to 6 business days. Keep that in mind. And while you're calling, you can call through this number or through WhatsApp. And why do you want to opt for Fidicus? It is because of the highest rates of success that people have seen. The testimony, you can check our website and the testimonies in it. And also the treatment is transparent and the medicines will be delivered to you in highest quality and then within 5 to 6 business days anywhere in the world. Thank you.
Fidicus Homeopathy.